Good afternoon. Today we have to perform the musculoskeletal assessment. So, and the musculoskeletal assessment is a very simple exam. So, but we need to look for the general aspect of the patient, looking for deformities, looking for the joints, the range of motion of the joints, I mean, and swelling of the joints, as well as some bone deformities or swelling or malformations that we can find in the assessment. So it's the same, the head-to-toe assessment, but only focusing in the musculoskeletal system. So, and starting by the appearance of the face. So, and it's easy the first time to explore the temporomandibular joint. So, we need to explore by inspecting, palpation, and then for the movement. Okay, so we can continue. So looking for the range of motion of the spinal spine. So looking for first inspection, and then for the movement of the cervical spine. So flexion, extension, lateral movement. So, and now it's something that maybe makes it in the neurological exam, but we can perform here to see the muscular strength from one side, other side, front, and back. Now we can follow with the shoulders. And I said before, the inspection is the first step. So we need to inspect the patient, looking for deformities or masses or any other condition that the patient may have. So, and as well, we need to look for the joint. So we need to after inspection, we can proceed to palpate the structures inside the joint, looking for swelling, tumors, anomalies, and of course then the range of motion of the joint. So it's bilateral, and of course we need to go back to the other different signs. And I said before, in first inspection, and then we need to proceed to the palpation, and then to explore the movement of the joint. So can you proceed to see that in that way? Other way. Okay. The other important part of the physical exam is the range of motion of every joint. So, and to explore the range of motion, we can perform different maneuvers, but and it's better to some exercises that are better, including for this the range of motion, also the muscular strength at the same time, in order to make it easier and shorter the exam. So can you do it like this? So, and you press down, you press up. Okay, now straighten your muscles. Okay, up, down. Okay, that's good. And because the patient has a normal range of motion, he can go. Okay, up and down. Okay, when the patient has no swellings, no pain. Now you can proceed down. So looking for the elbows. So, and of course the same order inspections first, and then looking for deformities on nodules, something or anomalies in the elbows and every joint, and of course the range of motion. The palpation of the structure of the every joint is very important. So we need to palpate the joint, elbows, wrist. In the case of wrist, it's very important to note the hand. So because we need to keep in consideration that the patient with some diseases like a carpal tunnel syndrome maybe has atrophy of the thenar eminence in the hand. So that's why the inspection is so important. Then we can proceed to the fingers in order to look for nodules, swellings, in special some deformities like swangans and all that appear in the rheumatoid arthritis. After they perform, remember the exam is bilateral. After they perform the other side, so we can proceed to explore the limbs. So of course, and I said before, starting for inspection of the patient. So in that case, we start to explore the knees. So we can palpate the structure of the joints, patella. Okay. The ankles. And now we're looking for movements and muscular strength. Can you push up? Okay, now, okay. And then the ankles, the muscular strength, and up. Now we can proceed to the exam of both hips. Okay. For the hip exam, always, you need to start for inspection of the patient and symmetrically or bilateral. Okay. Then we can proceed for palpation of the structure of the hip. So, of course, looking for the same that I said before, anomalies, masses, deformities, and something else. Okay. We can proceed to examine the range of motion of the hip. So. Next is for flexion, and that way in the run of motion, and of course bilateral. We also can explore at this time the muscular strength of the hips. So in that way we can go down, now up, okay. And of course, of the other side. So now we are going to explore the spine. So, and this is very important part of the exam. We are looking for deformities. Sometimes it's very apparent, and sometimes not. So we are going to look for symmetry, for the symmetry of the spine. Now we are going to flex the patient and to explore the shoulders, looking for any old elevation since one from another, and then we need to start looking for symmetry or alterations that can produce scoliosis. My name is Alfredo Lau, and in this way we finish the musculoskeletal exam.